Hello there, I'm Kate Miles from the Mind Body Reset, and I'm here today to talk to you about adult ADHD. Now, ADHD in adults seems to be on the rise, but we're not necessarily starting to develop the condition later in life, as generally sufferers become symptomatic before the age of 12, and in many cases even below the age of 6, as ADHD is actually a long-standing trait that may only be noticed in adulthood or may have recently worsened. Classically, symptoms are classed as either inattentiveness or hyperactivity impulsiveness. In adults, though, the symptoms of ADHD can be more difficult to define, as obvious hyperactivity may decrease, while stealthy inattentiveness tends to remain. Now, the symptoms of adult ADHD are thought to include carelessness or lack of attention to detail, continually starting new tasks before finishing others, poor organisational skills, inability to focus or prioritise, continually losing or misplacing things, forgetfulness, restlessness or edginess, difficulty keeping quiet, speaking out of turn, blurting out responses, interrupting others, mood swings, irritability and a quick temper, inability to deal with stress, extreme impatience, time management issues and risk-taking, often with little or no regard for themselves or the safety of others. For example, driving dangerously. Now, the cause is not fully understood, although a combination of factors is thought to be responsible, most notably genetics, brain function and structure, plus other risk factors. Now, genetics-wise, ADHD tends to run in families, so the genes you inherit from your parents are a significant factor. Brain function and structure-wise, studies involving brain scans have suggested certain areas of the brain may be smaller in those with ADHD, whereas others may be even larger. Also, it's thought that sufferers may have an imbalance in their level of neurotransmitters, or that these chemicals may tend to fail. Groups at risk may be individuals who were born prematurely or with a low birth weight who suffer from epilepsy, and those with brain damage, either in utero or after birth at some stage due to a severe head injury, are thought to be most likely to develop ADHD. Now, diagnosis in adults can be challenging, especially if you don't have anyone who knows what you were like as a child. But if you have 5 or more of the symptoms related to inattentiveness or hyperactivity impulsiveness, and your symptoms are having at least a moderate effect on several different areas of your life, such as underachieving at work or in education, driving dangerously, difficulty making or keeping friends, and difficulty in maintaining relationships with partners, then you may be able to be referred to an NHS specialist or even self-refer to a private clinic. Now, if your symptoms are more recent, so didn't occur regularly in the past, you may not be diagnosed, as it's currently thought ADHD can't develop in adults unless they have suffered from a traumatic brain injury. However, while stress is not considered to be causative, it can trigger an increase in symptoms that were previously expertly masked, therefore giving the appearance of a new onset. And treatment can help to make the condition much less of a problem day to day via medication or talking therapy, but a combination of both is generally best. Now, medicine doesn't offer a permanent cure, but may help sufferers concentrate better, be less impulsive, feel calmer, and learn and practice new skills. It's important to let your GP know if you experience side effects or medications concerns. Now, therapies such as psychoeducation, behaviour therapy, social skills training, and cognitive behavioural therapy can also help with symptom management. Self-care is always worth consideration, but should be overseen by your medical team. Advice may include diet and supplements. Now, diet-wise, it's best to eat a healthy, balanced, regular diet. It may also be helpful to keep a food or symptom diary to help you notice any links between a specific food or drink and your behaviour. Then discuss this with your specialist. Supplements like omega-3 and 6 may be beneficial, although the evidence supporting this is currently limited. So do check with your doctor, especially with regards to medication interactions beforehand. Other options. Now, stress is a known trigger, so stress management is an important consideration. So do explore the following to see if you might benefit. Gentle exercise in nature, breathing exercises, mindfulness meditation, gratitude practices, affirmations or EFT tapping, and journaling. Plus, why not consider sentimentology, a blend of hypnotherapy, guided visualizations, and lucid dreaming, to see if this will help you calm your mind and improve your focus. If you're interested in how the Mind Body Reset could help you tackle your health concerns, please DM me to ask a question or set up a video call. Thank you for watching. I hope you found that helpful. Goodbye.